Well, that's fine. I just want to make sure. Oh my God.
Okay, we'll get started now to respect everybody's time. Um, my
Okay.
name is Jim Hawley, and thanks everybody for attending this New York State Overdose Response Strategy quarterly learning session, which is going to feature the Matters Network. And you'll hear more about the network from them and during Lisa's introduction. Um, Lisa, if you could do the next slide, please.
Yeah, absolutely. Give me 1 second, please. Chief. Okay.
Okay. This is our federal acknowledgement. I'm not going to go through it, but everybody sees it. Next slide, please. Okay. So just a bit about the ORS. It's an unprecedented and unique collaboration between the Office of National Drug Control Policy through the HIDTA program, which I work for, and the Center for Disease Control through the CDCF, which Lisa represents. And what it is, it's a two-person team in every state. Puerto Rico, the Virgin Islands, and the District of Columbia. And our focus is on reducing overdose, both fatal and non-fatal. And we do this, through a few ways. The first is by forging crucial multi sector partnerships, which I think is well represented on this call. We have people from public health, public safety, probation, education, and we thank you all for being here today. The next is by sharing information and pertinent intelligence, whether it be drug trends, overdose data. We try to share everything we get with our partners across the state. And the third is by assisting in the implementation of proven and effective strategies. We've worked with a lot of people on this call and done some really good work in Leave Behind Naloxone, overdose fatality review, OD map, and some prevention strategies. Um, so what we're here today to talk about is how we can help you enhance what you may already be doing in your.
Hello. Can you make sure he's drinking water, please? Thank you.
Hey,
Yeah,
Jim,
he's at 381 going up.
Jim, if you pause for a second, I'm
Thank you.
just going to mute everybody. And then doesn't seem to be working to allow me to mute everybody. So just a reminder, if we could ask everybody to please mute yourselves. I'm going to, let's see here. Okay. Jim, can unmute yourself and continue. Thanks.
Thank you,
I'll go
Lisa.
back. Yeah.
So I was saying we have many partners on the call. Just to point out a few, I see some of our friends from the National Guard here, New York State Department of Health, many county health officials that we've worked with in the past. And we thank you all for taking out the time to be here today. I think you'll take a lot from this. Matters is a great program. And with that, I'll turn it over to Lisa, and she can touch on some ORS material and introduce our speakers for the day.
Okay, great. Thanks, Jim. Just for everyone, hopefully you've seen this. If you're on our listserv, you've received a notification about our new resource hub. And really, this is the going to be the go-to place to find out any information about future learning sessions, as well as other projects that we work on, some of the things that Jim referenced in that previous slide that we do. And we also want to direct you to our profile page. It's new on the national ORS page. Each team now has the opportunity to have a profile page that highlights specific areas of work that we're doing with people within our jurisdiction. So some of the community opportunities that we've worked on that are on this call today. The work that we're doing with you is highlighted there. So offer you this so that you stay connected and gives you ideas to ways that we could potentially partner. Sorry, move back. So we also want to give you a reminder about the National Trends Analysis and Threat Calls. These are hosted by the National ORS. They are not hosted by Jim and I as a New York ORS team, but they're available. We invite everybody as part of our network to join these really informative calls. They're bi-monthly. They provide briefings on current and emerging drug trends, really from experts from forensic and toxicology labs. And we find that a lot of people within our network are really enjoying these calls. And we encourage you, if you're not already on if you haven't signed up for these webinars, please do so. If you're new to the calls today, you only need to register once. So if you've already participated, you don't need to register again. But if you haven't, we encourage you to attend. We think that you'll find that informative. That's a resource and information that we don't get very often. And one of the things that we've heard from a lot of our partners is the need for relevant current and emerging drug trend information. And this is a great resource for you. So we invite you to attend. So next, I'm going to stop sharing here. And then I'm going to let our colleagues set their stuff up. So just to introduce our partners from Matters, we're really excited to have them here. You know, one of the reasons that we want to host these quarterly learning sessions is we try to highlight topics of interest to partners across New York State, but we also know that there's valuable resources throughout the state too that that you can leverage to support your work. So that we're really excited to spotlight Matters here, the Matters Network. It's a practical resource for so many partners. We really consider it the resource you didn't know you needed. They offer a range of overdose prevention, education, treatment, resources that really for professionals across all sectors to support your work in serving the people in your communities, the people who are impacted by substance use disorders. So we're confident that what you're going to learn today is going to be useful for your work. And so with that, I'm really pleased to introduce our two colleagues from the Matters Network. We have Phil McNamara and Shelby Arena, and they're going to walk us through the Matters Network and what they offer and how you can leverage those resources. So thank you, Shelby, and thank you, Phil. We'll let you get started.
Thank you, Lisa, and thank you, Jim, and thanks for everybody for joining us today. Just going to introduce myself. My name is Phil McNamara. As Lisa mentioned, I'm the Outreach and Implementation Manager here at Matters, based in our Buffalo office. I'm joined by Shelby Arena, who I'll let Shelby introduce herself now in 1 second. I see some of our partners here on the call as well, some familiar faces, so it's great to see some friends joining us today. But just to give you a little cover of what we'll go over today, some of you may already be familiar with the Matters program, so I will, some of you may not. So I'm going to go over just a very brief history, a brief breakdown of all of the programs that are wrapped up in the entire Matters program. And then I'll pass over at one point to Shelby, who runs our overdose prevention program, and let Shelby go through all of the individualized programs that we have under that banner as well. So hopefully you'll get a big overview of the broader programs and then some of the specific breakdowns of each individual program. So if everybody's okay with it, I'll just go ahead and start getting into the program. Actually, sorry, I did say I'd let Shelby introduce herself first, so I'll pass over to Shelby. Just let her say hello.
Thanks, Phil. You did a great job. My name is Shelby. I am the Overdose Prevention Manager. Phil covered it, so I will be talking to y'all briefly about our initiatives as well and some upcoming opportunities to collaborate. So looking forward to it. Thanks.
Thanks, Shelby. So for those of you who are not familiar, the Matters program was started here in the Buffalo area by Dr. Josh Lynch. Dr. Lynch he was at the time and is still an emergency room physician who was seeing a lot of inadequacies in the emergency room that he was kind of working in. He was seeing people come through for opiate-related disorders, whether that was post-overdose or post-acute withdrawal. They'd be effectively treated within the emergency room situation for their symptoms. But he would often see the same people after they were referred to care. He would often see them return to his emergency room for continued care. So clearly he was seeing a breakdown in that care cascade and decided to look a little further into those issues and see what some of the potential barriers were. In doing so, he found that individuals who suffer from substance use disorder and mental health disorders often face additional barriers, including stigma, that led to either a lack of appointment availability or lengthened time that it would take for somebody to get connected to an appointment. Individuals would often face phone numbers that were not working, long wait times to get in to see a provider, or surely a lack of providers in certain areas across New York. They also face additional barriers such as the financial and transportation aspect of care, whether you were in a geographical area that didn't have any care providers, or whether that was a lack of transportation or financial aspect to cover your insurance to cover that aspect of your care. So in response to that, and in partnership with UBMD Emergency Medicine, Dr. Lynch founded Matters with a simple concept to try and get individuals connected to outpatient OUD providers from that emergency room. So what we do here at Matters, we offer a rapid referral platform that's used to effectively link individuals with OUD to MAT programs 365. We offer lots of patient wraparound, including overdose prevention and patient follow-up. So today what we'll do is we'll go through each one of these programs very briefly to give you an overview of how this system works. All of these services have been made available and thanks to our partners and our funders, some of which are shown here on this slide. Some of our goals here at Matters are to connect individuals to their treatment organization of their choice within 72 hours of that initial encounter. We want to minimize that window of time from when the individual is encountered to when they are cared for. That moment can be a really fleeting moment. So we want to make sure that you and our partners in the community have a tool that's available to them to make use of that fleeting moment to get somebody connected to care. And for those who are not in a medical setting, we want to be able to make sure that they have access to an MAT telemedicine provider for an evaluation if needed. Our mission here at Matters is that we want to make getting help simple, human, and stigma-free. We want to connect people to care and resources and community support wherever they need it most. And our vision is a future where people are met with dignity, supported through meaningful connection, and are able to access care that they choose when they need it and when they are ready without delay. Some of the core values that we have here at Matters, and we hope that these core values go some way to addressing those stigma-based issues that we mentioned on that first slide. So we hope that our partners don't place counseling appointments, group sessions, or other requirements ahead of that person being seen and evaluated for MAT or continued on MAD. We hope that individuals they won't be disqualified from continuing on MAT if they are continuing to engage in polysubstance use. We also hope that our partners, our people who are referred are treated on an unbiased basis, regardless of their insurance status. So if somebody does come to your clinic uninsured or underinsured, we do ask that you at least see that individual for their initial evaluation, continue them on medication, and connect them to an insurance navigator or a Medicaid navigator to try and get that visit covered and backdated if possible to make sure that continuation of care can happen. This is a brief map that's just showing the extent of the Matters network. We recently just we updated our platform on where the Matters network is housed. So we've had an opportunity to really reconnect with all of our partners and to make sure that each of our partners are fully updated and active on the Matters platform. So you can see that we have multiple types of sites, referral sites, any organization who can be in the community, EMS, law enforcement, whatever that might be. You can make a referral to one of our treatment sites. Also included in a Matters referral is that connection to peer agencies if necessary. We also shown here on the map that we have multiple private and independent pharmacies along with multiple chains. So this just shows the extent of our partner network across New York State. We have in the last number of months also We have also started working with certain counties outside of New York, including Allegheny County in Pennsylvania. And just earlier this month, we launched the Matters platform in Camden County in New Jersey as well. So we're starting to see great success in other regions outside of New York. These are just some areas of major collaboration that we've been able to extend the model of Matters into these areas of partnership. We all know that the kind of corrections, law enforcement, and that period of time between when somebody has been incarcerated and when they go through the reentry process is a really high risk period of time. This is just one example of a specific major area of collaboration. We've been able to provide a great safety net for individuals passing through that period of reentry, which can be, again, a really high risk period of time. If their facility doesn't have access to telemedicine, we've been able to provide bridge scripts for people going through the reentry process. Our medication and transportation voucher ensure that individuals who their Medicaid has been paused during that period of incarceration, it may not have time to be reinstated before their reentry date. So if that is a case, we often find that people kind of lose their gap in they have a gap in medicated coverage. So our medication voucher covers the cost of any potential gaps to ensure that continuation of care can happen and that people don't drop out of care. We also partner with lots of EMS and law enforcement agencies to provide overdose prevention tools and resources. We also have a telemedicine card that a lot of our partners leave in their leave behind kits that provides a direct access for people to get connected directly to a medical provider for an evaluation in a space that they can feel safe and comfortable in. So that map and these areas just show the extent of the network. How do you get access to the network? Simply by visiting mattersnetwork.org, you can get connected to treatment. You can visit any of our educational materials, visit our overdose prevention site, order materials, order resources, or simply click on treatment and get connected in multiple ways. You can make a referral directly here if you're a partner, or you can get directly connected to virtual care by visiting mattersnetwork.org. You can also access the Matters Network by downloading the Matters Network app and always have it on your phone, where again, you can get access to all of those areas. You can submit a referral, get a request for telemedicine. You can order our overdose prevention supplies, learn more about the vending machine program that Shelby will go through in a lot more detail very shortly. So these are all available on the app. So it's right there in the palm of your hand. So far, we've reviewed the elements of the program, a little history, and the overview of it. Right now, I'm going to step through and go through each element of that program in a little more detail. So we're just going to start off with what we have at the heart here of Matters, which is that connection to care. Matters was created, again, to get people from that emergency situation, wherever that is, the emergency room, law enforcement, or incarceration, whether that's in a community event or a peer setting. We want to be able to provide a tool for our partners to use the Matters platform to get access to over 2,700 appointment available slots that have been set aside specifically for Matters appointments at any one of our treatment providers. Part of that referral, the expectation is that you will be connected to, that the treatment provider will connect to the individual within 24 hours and hopefully can be seen within a 72-hour period. Again, we have over 2,500 appointment slots. That's actually above 2,700 now at this point. And part of that referral is also included the option to connect to a peer in recovery for support. We have a number of peer organizations. I see one or two of them again on the call here today, who will also receive referrals for peer support. They will reach out to that individual and connect with them and offer whatever additional support that that person needs in that moment or through their recovery journey. This is just one of the wraparound services that we find really adds a layer of quality and depth to a Matters referral rather than just handing somebody a simple phone call to get connected for an appointment. So thanks to community feedback and feedback from our partners, we've also developed a lot of other supportive programs around that linkage to care. Two of those that we'll just go over right now are our medication and transportation voucher. These wraparound services really provide, as I mentioned, along with the peer referral, an extra layer of care and support for that individual to remove some of those barriers that we mentioned earlier in the presentation. So for those who are uninsured and underinsured, we have our Matters medication voucher. That covers up to 14 days of any combination formulation of buprenorphine and naloxone. That voucher is accepted at over 1,000 independent pharmacy locations. It's over 1,000 pharmacy locations, including a number of independent pharmacies. We also partner with 4 major chains, as you can see here: Walgreens, Wegmans, Duane Reade, and CVS. That all participating chains on that group accept the Matters medication voucher, including in Pennsylvania and New Jersey. So this voucher has proven to be a really beneficial short-term solution, but in partnership with New York State Department of Health and OASIS, we've been able to partner to provide direct access to BUPAP, which also provides a much longer-term solution to that gap in insurance or the financial aspect of care. So for those not familiar, BUPAP is a program that's based on the highly successful ADAP program, which is the AIDS Drug Assistance Program. So this is the buprenorphine assistance program. For those who are eligible, which the eligibility qualification is anybody below 500% of the federal poverty line, that works out at $78,250 a year for an individual. So a lot of individuals will qualify for this. So any qualifying individual can be connected directly and can be immediately approved for immediate access to BUPAP. So within one phone call to Matters, you can get a referral to care, you can get a bridge script from a telemedicine provider, and we can connect you either to your medication voucher or BUPAP immediately, so you can take either to any participating pharmacy to have your medication paid for up to the course of 1 year. Just to clarify again, our medication voucher covers for 2 weeks, and BUPAP can cover you for the period of up to 1 year as long as you qualify. We also partner with Uber Health as our main transportation provider. Uber Health covers our ride from the first 3 clinic appointments, including a potential pickup at a pharmacy as well. So removing that initial barrier of any transportation or regional access to getting connected to a provider. So where Uber is available, you can simply contact Matters once your appointment has been scheduled. We can then connect you to an Uber Health transportation that can take you to and from your first 3 clinic appointments. Hopefully within that period of time, you can resolve your insurance issue, get connected to Medicaid cab for long-term transportation. And for those in areas more rural, where Uber is not available, we've also extended this voucher to include non-medical transportation with some of our peer partners across the state. So where Uber is not available, we've been able to partner with local community organizations who offer non-medical transportation. And now we offer transportation in a lot of rural areas that were previously underserved. So if that person is not in a medical setting, we also get people connected to a telemedicine referral. So if the person is being seen at that, who's not, let's say they're outside an emergency situation, they're on a community event or with one of our peer partners, our peer partner or the community partner can make a referral to care, but they can't write a prescription. So if that person's outside of a medical situation, you can get connected to our telemedicine providers. All of our telemedicine providers here at Matters, this is offered in partnership, with UB MD Emergency Medicine. It's actually called EM Connect, which is our branch of UB's emergency telemedicine. They are all trained on the Matters platform, so you can get connected to a provider. You could be seen in as little as 1 to 2 hours. You could be connected from anywhere around New York. Here in Western New York, that is available 24/7. For the remainder of New York State, that's available from 11 a.m. to 11 p.m. Simply visit mattersnetwork.org. As I mentioned, all of those providers are trained on the Matters Network, so they can see you for your appointment, evaluate you for your MOUD, start you on a bridge prescription if necessary, and then facilitate a Matters referral for long-term care, where that person can obtain all of those wraparound vouchers. So this process has been an incredibly beneficial and an incredibly helpful program to get people connected who have that gap in medication, especially in those emergency situations and especially after hours as well. We do provide our partners with a telemedicine card, which I can show you right here. This telemedicine card is simple instructions on how to get connected to our telemedicine providers. We often partner with our peer partners and our overdose prevention partners to provide those cards to be placed in naloxone leave-behind kits. We work with EMS and law enforcement to leave those in the community wherever possible to provide direct access to care in those non-emergency situations. So at this point, I'm going to just pass over to Shelby to just go into our overdose prevention resources, which are, again, a substantial part of the Matters Network.
Thanks, Phil. So the first thing I'll touch on is our test strip distribution program. This is kind of one of our first initiatives outside of the naloxone distribution. And so right now we are able to send fentanyl and xylazine test strips to individuals and organizations across New York State free of charge. These orders can come in through our website, and all the packages are sent within the next week, sent in discrete packaging. So, for folks who are receiving these supplies at their homes, we do take kind of confidentiality and privacy into consideration as well. There are different quantities available for individuals versus organizations. And one of the cool things that we've been able to do along this process is work with our manufacturing partners to develop test strip instructions, and those have kind of evolved along this process to make sure that they are, accessible, understandable, and that they are, immediately available. For a lot of test strips, the instructions aren't available on the test strip packaging. You have to go to their website or, some other place to find out how to use them. So that's something we're really proud of, being able to add that onto the test strips and kind of just increasing that accessibility and some of those barriers into using some of these supplies. And Phil, we can go to the next slide. We've also established a community advisory committee, and this is really to make sure that the people that we are serving have a seat at the table. Not only that they have a seat at a table, but that our programs and services are, what they're looking for. We can all sit in a room and brainstorm, the things that we think are best and that are going to be accessible for people. And then we can get one person in the room who kind of points out a major flaw, right? And so having these people at the table from day one, not only helps us to have better programming, but helps us to make sure that we are being effective and uplifting and, empowering people with that lived and living experience. And so, right now, our CAC meetings, they're intended to be quarterly. I will say we haven't had one this quarter. But the thing that's really important to me about our CAC meetings is that we do, offer payment to the people who participate in this, because, coming to the table and sharing some of your lived or living experience, kind of maybe some of the negatives that have been associated with trying to access treatment or any other types of services, that can be, re-traumatizing or triggering for folks, right? We don't want to bring people to the table and have them kind of, share all these hard things and not kind of, provide compensation for that, right? We're looking to them for their expertise, and they should be compensated as experts. So we are able to offer them $100. It's actually, it's a Visa gift card or a cash gift card for each session. And so we are continuously recruiting for our CAC meetings. So if you have any participants or if you have lived or living experience, we definitely love to hear from you. Next slide, please. One of our newer initiatives are our naloxone wall boxes. So we have started distributing these wall boxes. The first one is just a standard wall box. It's a red metal box that holds two doses of like a standard Narcan box. On the side of the box are instructions for use. We can send up to 10 of these to organizations within New York State to place anywhere really in the community. We do ask where you're placing them just so we have an idea, so we can direct folks to where Narcan or naloxone is located in the community. And then to the right we have our one boxes. The one boxes are pretty cool because, again, it's a wall-mounted box that holds a dose or two of naloxone. But when you open it, I should have brought one in here. When you open it, there is a cardboard flap that you can pull down, and there is a little video screen in that cardboard flap that starts to play a video on how to respond to an opioid overdose. It's a quick 60-second video that can really help folks, navigate that process. There's also a training mode. If you hit training mode, it's a longer form, like 5-minute video. This is really good for places where, maybe it's like a convenience store. They might not, have the time or capacity to bring in a full overdose response training, but they can have new employees just kind of click through this 5-minute video to get a better understanding, if there were an emergency. Both of these videos are also available in Spanish through the box. These ones are at a little bit of a higher price point, so we're only able to provide 2 of these per organization. But these are some pretty cool, again, free resources available through Matters. And then we have our vending machine program. And so for folks, we actually we started with our test strip distribution, mailing these supplies to folks in their homes, and then wanting to take that one step further. Not everybody maybe has a home address to receive these supplies or feels comfortable receiving these supplies or has the time to wait to receive something in the mail. And so we took, this initiative one step further with our vending machine program to place these machines in the community, where people are at. And so they're accessible 24/7, 365. So they are all located outdoors. It's a temperature controlled and weatherproof machine. So all of the, the naloxone test strips stay within, a regulated temperature. It also has, it's connected to the internet. So we have some pretty cool reporting capabilities too, just to see, what types of products are being vended, what time of day or night folks are coming. And we recently published a paper, a quantitative paper looking through that transaction data, and we found that about half of our transactions are happening after regular business hours, which just goes to show that having that 24-hour access, after 5 p.m. Really is important, because half of the folks are coming during those times to access supplies. And I do see lots of folks in the audience that have a Matters vending machine or a vending machine of their own, so we really appreciate the collaboration. Right now, our vending machine network is 45 strong. We have 40 of them live and operating right now. We have 5 more that should be live and operating sometime this year. But we also have 5 more placements available. So if you are an organization in New York State and you're interested in hosting a vending machine, I would love to speak with you. Matters covers the costs, and we also provide the supplies. We just ask you for, to be the physical host and kind of the boots on the ground, stocking that machine and maintaining it. So I would love to connect on that. We also recently published a paper on the implementation, kind of a qualitative paper on the implementation piece, kind of the pros and cons and lessons learned. So, throughout this process, there might be some folks on the call that have really helped us to kind of iron out some of the kinks, and hopefully, we have it down now, and we can make this as smooth of a process as possible. The one thing I haven't mentioned yet, we also offer our a leave behind naloxone program for law enforcement partners. So our naloxone that I mentioned earlier is mail-based to individuals. We can only really send 1 box at a time, or through the vending machine. It's not the most accessible to sit there and vend a bulk amount of naloxone. And so for our law enforcement partners, we are able to provide them with that bulk naloxone for their leave behind programming. So we send them boxes of naloxone, as well as the little blue zip bags and telemedicine cards, so they can create a little kit to leave behind, after an overdose, or any other type of incident where they think that information would be beneficial. So if you are a law enforcement partner that is struggling to get naloxone, that is something we can also help out with. And I think that might be it for my slides. I'll hand it back over to Phil.
Thank you, Shelby. And I just wanted to kind of take a moment to commend Shelby and her small team. They've done a huge, incredible amount of work. Some of the biggest programs, if not just here in New York State, but in the actual country. And they're a very small and very hard work and dedicated team. So just to give them a shout out for all the work that they've done across the state. But as I excuse me, as I just go back to the overall programs that we had here, everything that we've mentioned so far have all been highly automated. We make that lift as easy as possible for our partners and all of those using the Matters platform to make it as easy as possible. One thing that's really important to us here is to make sure that we don't lose sight that there are actual individuals going through this process. And it has to be a kind of person-centered process as well. So to focus on that, we made sure that we've added our follow-up services. We have a dedicated team who reach out to every single individual who's been referred through the Matters platform. They reach out on a 24 to 72 hour basis. They also connect on a 30, 60, 90-day basis to assess continuation of care. But the purpose of this call is to really connect with the individual, to offer them any additional support, to make sure they've been able to access all of those barriers or all of those programs that address those barriers. Were they able to get their medication? Were they able to access their voucher? Did they need a BUPAP application? Were there any other additional barriers that we can help with? So this is a really valuable way for us to get direct feedback from individuals who are going through the process to help us improve the process itself and to make sure that people get connected. And then those further follow-ups on 30, 60, 90 allow us to reconnect with people who may have dropped out of care and assist them to get reconnected as well if that's what they choose. So our follow-up services really just adds a layer of quality and kind of human connection to each one of these highly automated processes. So just to recap, again, we have the overall linkage to care is the main kind of process or the main program. And along with that, we've added our telemedicine providers, our medication and transportation vouchers to offer assistance to remove those barriers, our overdose prevention resources that Shelby went through, and our follow-up services. All of these combined wrap up to create what the Matters program does. We had a question there in the chat a little while ago about how can our community partners kind of join and help in that process. I just added our email addresses there so they can reach out. And all of those processes that we just went over are only possible with thanks to our partners, our referral sites, those treatment sites, our peer partners, our partners who access those vending machines. So we're very grateful to those partners who allow us to continue to make connections. This just confirms the overall process. Once a Matters referral has been completed on the Matters Network app or on the website, the partner themselves making the referral will receive emails to confirm that they have access to their homepage that has all of their relevant information. The treatment partners are notified, and their expectation is that they reach out and connect the individual within 24 hours. Their peer partners, the expectation is the same. They will reach out to those individuals within 24 hours to get them connected. The individual themselves will receive all of those communications in a secure format, either by a secure email or text message link. That will include their medication voucher, transportation instructions, additional resources to overdose prevention supplies, and then Matters, as we mentioned, will follow up to make sure that the person has gotten access to all of that. And that concludes our presentation today on the Matters platform. As I said, all of that is made possible because of our partnerships in the community and on the ground. So if those of you who are not familiar with Matters are interested, please feel free to reach out to either Shelby or myself. We can connect you to the appropriate team members, but we're also happy to answer any questions that anybody on the call might have.
Shelby and Phil, that was great. Thank you. A lot of information there, a lot of great resources. So I do see a question here, and please, you can take yourself off mute or put a question in the chat, and we'll facilitate it and get those questions to Shelby and Phil. So I did see a question here specifically about the literature for Leave Behind Naloxone program can to give to local PDs on how to get Narcan from Matters. They're a general distribution source for the county's PDs. as a registered OOPP, but it may be useful to pass along some literature for the PDs to order directly from Matters. So we have some resources we want to talk about, but I want to let, I think this is Shelby, that will let you take that one.
Yes, thank you. We don't have any direct literature. We actually do refer to the ORS for kind of that, what even is LBN and how do you get involved type things. So on our website, we really just have like an interest form, and then I'll reach out and set up an onboarding or an informational session. But there are lots of great resources that I'm sure Lisa will be able to speak to better than I can, but that's kind of where we refer to for that type of stuff.
Thank you. Yeah, so we just created a new Leave Behind the Naloxone resource page specifically for public safety. And this is, when we speak about public safety, we think of law enforcement, EMS, our corrections partners, our probation partners. So we have a whole resource that we just put out. It's a toolkit that walks them through steps on how to implement. We also provide technical assistance, like a one-on-one call or just to talk through what their implementation needs might be. But all of that information is there, and I put it in the link here, and I encourage you to please refer to that and direct your public safety partners to that resource. One thing that we're also working on now is just a message for community organizations, public health agencies, a general message about Leave Behind Naloxone that they could use to invite their public safety partners to participate and implement a Leave Behind Naloxone program. So that's coming soon.
And if I could just add there, Lisa, these resources were made with input from the law enforcement community, and it has general orders and roll call videos and everything. And everything is simple and sweet, short, which appeals to law enforcement, with time constraints and everything. So it's the places that have used it have found it very valuable. So please feel free to share that with your law enforcement partners. And like Lisa said, we'll follow up and work with them to implement it if there's interest in your counties.
Thanks, Jim. So I see there's another question. What's the difference between Matters and Reach?
Yeah, Lisa, I can answer that if you don't mind. As I said in the chat, great question. Reach are a really, really valued partner of Matters. We actually work with them quite often to offer services in the Southern Tier and beyond. So Reach are one of our telemedicine partners. They offer telemedicine for long-term buprenorphine care, whereas Matters offers our Matters telemedicine, the EM Connect. They just rebranded, so I'm trying to remember their new branding name. So EM Connect offer only that like short-term temporary bridge. They don't offer long-term care. So Reach are registered with us as a long-term care provider, and they offer, so if somebody comes through the Matters platform and wants a referral to long-term care, Reach and a number of other telemedicine providers offer a service that a lot of places won't be able to offer. That is that if you have a disability, if you can't travel physically to get somewhere, they can do long-term buprenorphine care fully virtually. So we have 3 of those partners who offer that, and Reach are one of those partners. So they often refer people to us. They utilize our voucher program to get people who have gaps in insurance. So we partner quite a lot with the team at Reach to offer care where there may be breakdowns in care. So great question. Hope that answered it.
Thanks, Phil. And maybe just one follow-up question to that, Phil, in case we have some providers on this call. If a provider wants to be a part of a referral site or a provider within the Matters network, what should they do?
Yeah, they can either reach out to me. I'm actually going to get a link to register. It's a really simple registration process. And once you go through the registration process, one of our team then will reach out to you to provide education, to provide materials on kind of the process itself, training on how to use that. So that's probably the simplest way, is to either reach out to myself directly. I can get you connected to the right people. We have a team of regional coordinators. So depending on where you are in the state, you'll have somebody who is dedicated to you and your region, who kind of knows the area, knows the kind of individual issues that that area may face, and would be that regional point of contact. But you can certainly reach out to me. I'm multitasking and getting you a link that I'll pop in the chat now in 1 second so people can register directly on that. So I'll pop that in there right now.
Okay, thank you. Let's see, we have one question in the chat, and then I see Tracy, please keep your hand up. We'll have you next. So there was a question about the vending machines. I was told the vending machines are paid for and stocked for 2 years. What happens after that time period? Will the community organization be responsible to pay, and what does that cost look like?
Great question. So our vending machines are grant funded. So the continuation of the program is based on that grant funding. I will say that the way that the program is set up, the community organization will ultimately be the owner of that vending machine through the grant or contract period. So once that period ends, if you want to continue keeping the machine up and running, that is completely up to you. So there wouldn't be a requirement, like if you don't have funding, you could potentially sell off the vending machine, you could give it to someone else, you could just let it sit there. So there would be no, financial obligation. If you did want to keep it up and running on your, out of your own budget, there is a $780 software fee. That is an annual fee to keep kind of the programming and being able to make the machine function. So that would be the cost associated. In terms of supplies, Matters does provide the free test strips, and the contracts are separate. So even if the vending machine contract were to end, that does not mean that the test strips are ending. So we could still provide test strips. And then there are also lots of resources for free naloxone. Yeah, those are kind of the things to keep in mind, but we've been continually renewed for the past 3 years, and do not foresee it ending anytime soon.
Thanks, Shelby. Tracy.
Yes, my question also is about the vending machines. I was trying to look at the map you put up. I'm not familiar with matters at all. I work in a school district. In Lower Westchester County. I'm trying to figure out where would the nearest vending machine be to me. I think based on your map, I saw one icon. It looked like New York City. I couldn't tell. How would we find out if we do have one near us? And that might kind of, spurn whether or not I would try to see or work with a community partner to say, hey, I heard about this. Is this something we would want to consider?
Yeah, great question. So I think you found the map on our website. I did just drop it in the chat if anyone else is interested. I know a lot of the bubbles overlap, but you can zoom in so you can get kind of more on a granular level. I hear kind of the unasked question here. I think we should be able to put in an address and say nearest vending machine, vending machine nearest you. So I love that idea, and maybe that's something we can implement. I'm not a website expert, so I don't want to make any promises. But right now we just have the map. Feel free to reach out to me to see, I can also tell you what's in your community. I'm based out of Buffalo, so I'm not geographically up to speed on where things are, unfortunately. We do have a couple in the New York City area, as well as in Rockland County, in Putnam County, in Dutchess County. So I think those would be the ones that you might be looking at.
Yeah, I think just the closest ones that would be there are the 3 that are in the Bronx or Rockland County, which is at it's 25 Smith Street on Rockland. So that's Rockland County on alcoholism and other drug dependence.
Yeah, I'm in Westchester County, and it doesn't look like there's anything in Westchester County, which is interesting to me. So, it's something that, I might be exploring with like DCMH in the county. Like, why do we not have one anywhere? That's interesting.
Yeah, so we do work with a lot of agencies within the Westchester County region. We sit on a lot of kind of stakeholder meetings down there. So I know a lot of the major players are very familiar with the vending machine program. And I'm sure Shelby and her team have worked directly with some of those to make those happen. It can be. I'm sure Shelby could talk more about how challenging it can be to find a location for them, but we're always happy to kind of revisit conversations. There has definitely been awareness, some level of awareness of the program, but we're always happy to kind of continue those, Tracy.
So, question. Over in Sullivan County, we did try to get the New York Matters machines, and just because of the red tape in the county, we weren't able to. But through the Healing Communities grant, we actually purchased separate vending machines. And we've gotten multiple requests for vending machines in our county because everybody goes to your map. Is there any way to possibly put our unaffiliated machines that have Narcan on your map? Just so people, even though they're not New York Matters machines, so people that go there for the resource are able to access Narcan. Does that make sense?
Yeah, that's another great question. We used to have other non-matters machines on our map. Unfortunately, our map can only hold so many, and once our program grew, we had to remove some of those. I will say, I don't know if I can say this, but I'm going to. There is a organization called Glowhopper. They're kind of like a startup, a tech startup that is looking to do naloxone mapping nationwide. And I have a meeting with them. I don't know what will come out of that, but I would love to connect you, or anyone else who is looking to kind of collaborate and kind of have a central depository for that kind of information, because I agree that that would be very helpful. So there is kind of like a third party working on that.
Thank you very much.
Of course.
There's a great suggestion here, Camille, to your question. Have you tried partnering with a not-for-profit in Sullivan to bypass the county red tape? It's a good idea to consider. Yeah.
We have brought it up to other organizations. It's just they have to want to sponsor it. So yeah, I guess we can bring that up again to see if they'd like to put another machine. It was just with the Healing Communities grant, the county had the money and we were able to purchase the machines instead of waiting and not having the resource.
Gotcha. Okay. Thank you. Let's see here. And you also have a message there from Chloe from the New York State Department of Health, Camille, that you might want to check out in the chat. Let's see. What other questions do we have? Well, while we wait, I do want to mention, and thank you, Ulster, for noting this. We've encountered this issue with our new Leave Behind Naloxone Resource Hub and our registration site and our general resource page, that some, I think it's mostly county systems and some law enforcement systems, their firewall blocks access to those sites. If a lot of you are encountering that, please let us know. We are checking with IT on our end to see what we might be able to do to reduce the risk of that happening. We think it might be associated with the fact that they're new domains and not recognized and looked at as a potential threat. But if you have that issue, please let us know, and especially if it's for registering for these sessions, we will get you registered. We'll just do it on the back end. So don't let that be a barrier, and then we'll keep you posted with the other, like the resource hub. If you're blocked, that's important for us to know. Okay. We do have another question here. Let's see. Actually, I would invite you all to please come off mute. It might be, let's see here. Catherine, did you want to come off mute and talk about your referral?
I can actually answer that.
Okay.
If you want. So the question is, when we refer somebody for a telemedicine appointment, do we have to use the website or the app, or is there a phone number that we can use to start the process? Catherine, that depends on where you are. We're very lucky here in the Western New York area that we have a specific program that offers access to our telemedicine providers 24/7. So that's the Western New York Addiction Treatment Hotline. I can pop that number here in the chat now in 1 second. But for the remainder of the state, it's preferred that we go through the app and the website. There are some telephone numbers that you can utilized, but they will typically direct you right back to the website to schedule the appointment. And that's usually what it's for, is to get access to the scheduler. But there are ways to do it. And again, I'll just kind of hold these cards up right here. That does have that phone number on it. These telemedicine cards are a really great resource and access to, we've mentioned a couple of ways that it can be utilized today. Shelby mentioned those leave behind kits. We leave a lot of these cards with those kits. Our EMS partners use them a lot. If somebody's has overdosed and doesn't want to be transported to the hospital, they can at least leave them with a direct contact to a provider. That person gets home, they feel a little more secure, a little more safe. They might feel more inclined to reach out themselves. Whereas if they've only been handed, a phone number or something like that, they may not take that step. So these cards also have a code on it for our partners, so you can actually see where the card came from. So it's all trackable. So we work a lot with our law enforcement and our corrections partners, so we can find out which jail facility or which docks facility has given you this card and where you came from. But those instructions are on there through the website and the phone number. And I'd be happy to share this resource with you as well, Catherine, or anybody else.
We have a couple of counties, I see Broome and is it Orange, that have talked about doing some mapping for naloxone vending machines and nalox boxes. I welcome you to come off and talk about it. If not, we can go on to the next question about, let's see, I'll give you a pause if you want to come on.
Hi,
Hi.
Hi, team in Broome County. Long time no see.
Good morning. So yeah, that link there is for our map in Broome County. So we have all partners on it that include our hospital systems that we've been working with, like our grassroots organizations, treatment providers. So it's every either vending machine or nalox box in Broome County. And then we also have a resource that has our sharps disposals and where you can take medication, unused, unwanted, expired meds as well. And then we've been going out and doing training with law enforcement, with our public health, public safety liaison. And I gotta say, they have all, when they do the survey at the end, commented how helpful it is to have that map available, just to know where resources are in their own municipality. So it's been really helpful, I think, in every sector that we've been working in. And during last year, we did a campaign, we did a media campaign that also included billboards, buses, bus shelters, and had a QR code. And I think, what was the reach on that? It was like 400. It was reached over 500% more than the previous year. So we know people are accessing it and using it. So it was really successful for us.
And then we've even gotten calls from pharmacists saying like, hi, where can I tell my patient to go get naloxone? Because I think their insurance required them to have it, but it wasn't being, so we could tell them like, here's where the closest box is. And so we've become a real trusted resource for naloxone locations.
Yeah, I want to give a shout out to Marty from Matters. She is our rep in our area, and she's been wonderful to work with. And of course, Jim Hawley too. He's our HIDTA rep. So thank you, Jim and Lisa, for doing this. But we've really been able to see it grow and then have data to support. And then our overdoses are down. Suspected fatals are down about 43% in the last 2 years. And we really believe that it has a lot to do with the naloxone distribution in our county and just how available and accessible it is.
Thank you, guys. Thank you for that
Thank
update.
you.
Great model. And again, that's Broome County. If you need connection, you can reach out to Jim if you want to learn more about that and model that for your county. We can get you connected.
Lisa, I see there's a question there from Nick. Can Matters help connect individuals to Subutex, or is it Suboxone only? So Matters, the medication voucher only covers that combination formulation. So it's any oral combination formulation. So it doesn't cover injectables, it doesn't cover mono products, so it won't cover Subutex. The providers through telemedicine may choose to do that, obviously, when it's clinically appropriate. And that's on a case-by-case basis. Like Matters will not tell a medical provider what is the appropriate form of medication for an individual to take. So if they go through the telemedicine process, they can have a conversation with the provider and they may choose that that's the right medication for the person. That's a clinical decision between the doctor and the individual, but our medication voucher will not cover the cost of it. And I believe there might be limitations. So again, injectables, it does not cover. Methadone, it doesn't cover. It's just that combination formulation.
Have a little bit more time if there's any additional questions or thoughts. Please feel free to come off.
No, you guys are doing a great job. All the information is really informative. Thank you, guys.
Thank you.
Thank you.
Okay. Well, Phil, Shelby, outstanding. Thank you. We're glad that we could use this platform to really increase awareness about your program and all the wonderful resources that you have and the opportunities to link people to care. And one of the things that, that we really wanted to highlight about their program, especially we know that we engage a lot of our public safety partners, again, EMS, law enforcement, corrections, probation on this call. And if you're doing leave behind naloxone, or we're not just thinking of it in the sense of at the overdose encounter, that after an overdose, that's wonderful to do it there. But you have those interactions with people who are struggling with substance use disorder throughout your work and any time. So we encourage you to look at any encounter, any opportunity as a way to leave behind naloxone. And we really love those telemedicine cards because your interactions are often very quick and you don't have maybe a lot of time to spend with a person, but that's a great card to offer to people because they can now, in the privacy of their own home, reach out for support that is available and accessible. And it's something that, people who, if they're struggling with stigma or the issues around stigma, they can do that in the privacy of their own home and get connected to care. And you've offered a valuable service and just a really quick interaction. So just a reminder for that.
Yeah, I like that it empowers them. It gives them the chance to empower themselves and make good choices. So I love that.
Yes, excellent. Well said. We love that.
Yeah, thank you for pointing that out. It's certainly become one of the most kind of powerful, direct, personally empowering tools that we have, along with all of the overdose prevention kind of materials that we have as well. It really puts the tools in the hands of the individual that they can use themselves when they're ready to do that. It takes the pressure off that kind of crisis moment to make a decision that you might not be in the right place to make at that moment. But also a lot of our EMS partners have told us in the past that they felt helpless in those moments when they know the person may want to get connected and they just may not be in the right time or space to do that. But the telemedicine card provides that linkage when you may be in that safe environment later on. So it's certainly proven to be a powerful tool.
And Phil, can you repeat again, how can we get the cards?
So you can just reach out to me directly. We can send you a PDF of them so you can be printed immediately. But we're working on kind of mailing them out to our partners as well. But you can either reach out to me directly, and I'll put my email again in the chat one more time. I can either connect you to your local regional coordinator. Marty just got a shout out from the Broome County team there. They've worked very, very closely and done a lot of great work in Broome County. Marty would very easily just drop them off. So if there's a local representative, they can maybe communicate to them, or we can send them out in the mail to you. So I'll put my email in the chat one more time, and then anybody who's interested in them can just let me know, and then we can figure out the best way of getting it to you.
Beautiful.
Thank you, Phil.
And just one last reminder, we've got some questions about this, how can people get the presentation or the recording? And we are going to post it on our registration site, on our learning sessions site. So all our previous sessions will be posted there that we recorded. They'll be available. And if you're having problems accessing the site, we'll also we have a YouTube page that we'll post it on, and you can access it there. So we'll push it out in a few days after this call. That will make sure you get all the follow-up materials and more information on the Matters program as well. Okay. I think, yeah, echo, great presentation, everyone. Jim, are we going to turn it over to you or to Chris?
I think we're all set.
Okay.
Yeah.
All right.
So,
thank you, everyone. We'll be in touch soon about the next learning session. We always appreciate your feedback of ideas when you fill out those registration forms to attend these. If you have ideas, we do look at them, and we have a lot of great topics, and we're going to try to get them as many as we can in throughout the year. So thank you again, everyone. Thank you to Matters, and have a great rest of your day.
Thank you all.
Thank you.